Good morning. You are getting poked currently, right this moment, by me, Laura. Hi. If you don't want to be poked, then carry on. Move on with your day. If you are already a member of Patreon, thank you. Patreon, some people love it, some people hate it. The reason I like it is that it's ad-free. There's nobody else involved. It's just me. So you're not going to be sold to anybody or anything like that. It's a place of true consent. You come if you want, you don't if you don't. If you are listening to this on a preview, please click and become a member because it really helps to support me. It boosts me up as a human being. It makes me feel human and like I'm contributing to this world, and that maybe I can be of service to you or someone that you know, care about, or love. So please share. Otherwise, if you like to watch, you can also watch me on YouTube. I live stream from my account Nice Needles, which you can pretty much find me by Nice Needles everywhere. I live stream on TikTok as Nice Needles, and then I upload those videos to YouTube for consumption on the same day. I tend to release at 8 a.m. every day. I appreciate your support. I'm here to make you think, to give you a different perspective, to educate, and to be of assistance in a time of great need. So again, not asking for any kind of monetary support. Really, I'm asking for your listenership and for you to share. I'm hoping to grow one person at a time. My goal is very modest at 1 billion people. And I think considering that we have about 8 billion people on the planet, I don't think that's asking a lot. It's just an eighth, right? It's just an eighth of the pie. It's not a lot. So today I want to talk about spiritual healing, which was the topic that was given to me on a live. I've been trying to get topics from people in real time rather than just coming up with them in my own head, because my head's a little weird, quite frankly, and I think I'm tuned in, but better just to hear it from the source. So we're going to talk about spiritual healing from my particular point of view today. If we want to talk about what is spirituality, I actually have an episode that I think posted today or yesterday about spiritual self space healing. What does that mean? It's not religious from the place I'm coming from. It's just really however you connect to a deeper part of yourself, I would say, or something outside of yourself, feeling and energy and experience, whatever that would be. So I would listen to that episode to get my take on spirituality, but it really is as it's defined by you, whatever that means. I was saying the other day about Ricky Gervais, who I absolutely adore. He's an atheist, and he does a lot of talking about atheism and, his particular views on religion and the world and whatever. But he's also like really connected to animals. He cares a lot about animals. I think he might be involved in PETA. I'm not sure, but he cares a lot about the abuse of animals. And so I would say for him, right, that's something outside of himself that helps him to feel connected to something else. And so I would say, not by his definition, by my own, I would view that as a spiritual practice, the care and love and support and protection of animals. So however you define that. So spiritual healing was the topic, true self. And I decided, looking at that, I was going to go in one direction with one particular thing in my medicine, but I thought, no, let's pull out and go a little bit bigger. My specialty, I can treat anything, okay? The patients that I had might come to me for particular things, but generally speaking, what people would find in my practice is that they might come to me for something really complex or difficult because no one else could help them with it. And they were sort of what people would find in my practice is that they might come to me for something really complex or difficult because no one else could help them with it. And they were sort of at the end of their rope. Once I was able to help people through whatever that particular crisis was, because that can take some time, that can take some weeks or some months in cases, in between there, right, people get headaches, they can't sleep, they might have a stomach ache, they might get a cold or a flu. And so through the process of them just being my patient in that issue, what they discover is that I am truly a general practitioner, as most people in my medicine are. Not all. Some people specialize in order to maximize profit, which I get because we have to survive in this world. But let's say you were coming to me for depression, right? That was your chief complaint. If you come to me and we're still working on your depression and we're still working on helping you to heal that, but you come that day and you have a cold, right? You got a little sniffle. You tell me that your neck hurts a little bit, and I feel your pulse, and I go, oh, Okay. We can't treat the depression today, darling. We need to treat the cold that's coming into your body. And people are like, no, but I really need to treat the depression. I'm like, okay, well, I get that. And we don't have to do needles. We can just talk and work with other energy and things like that. But you're here and we can do needles, and I want to help you get rid of this cold, because I cannot treat the depression with the needles. I can't do that type of treatment today. And we're going to talk about what that treatment type is that I do in a second. But I want to explain that, through the course of treatment, a lot of times people discover that I can help them do other things. And so generally what they do is they stick around afterwards, and then we can plug into these other issues. But whatever it is, I have a sprained ankle, I get colds and flus frequently, I'm on antibiotics a lot, I get a lot of stomach aches, I can't lose weight, I can't gain weight, I have menopausal flashes, I have menstrual cramps, I'm having terrible dreams, whatever it is, okay? I'm a generalist, so I treat those things. But what I love to do, my little geek out nerdy stuff that gets me excited every day, is working on what we call the 8 extraordinary vessels in Chinese medicine. And I just got really, really lucky in my particular school and area of study that I happen to have some of the best teachers who specialize in this stuff and look at this stuff in a way that was relatable to me. And I had the benefit of their instruction and their supervision and their classes, and it just resonated very deeply with me. And so I want to talk a little bit about that specialty, which I would say is, there's a few ways I would say it to people: psycho-emotional treatments, emotional-based treatments, spiritual-based treatment, or mental health-based treatment. However you define that part of you that is not the physical body, that is not a bone that you broke, or a ligament that's torn, or, some physical structure of your body that is in discomfort or pain. The other parts of you that might suffer or have great discomfort or be unresolved, those parts of your being are my favorite things to treat. I love it. And the reason I love it is that, like most people listening to this, I grew up in the Western world where, we have a very new field called psychology that is constantly changing and growing. And I applaud it for that, because boy, what a mess it's been. Even in my lifetime, in my 50 years, being a part of the mental health system has been a ride. And it's common. It is common that people get help. It's also very common that people don't get the help that they need, and that they're not really being seen and cared for. And, it's a messy field. It's a new area in Western medicine, relatively speaking. You have to understand I'm talking about a medicine, and I've learned a medicine that's thousands of years old. So it's very young psychology. So it's got some issues, right? I've been helped by Western psychology, but it took a lot of work, a lot of time, a lot of years, a lot of exploring, and a lot of not giving up. I got really lucky, and I found 2 amazing people in my 30s who radically helped me to shift my life, radically. But they were radical people living in kind of a radical city of healing, which is that of Los Angeles. So when I found this area of East Asian medicine, Chinese medicine, it was like, I'd never heard of anything like this before. I'd never experienced anything like this before. It's ancient, and it can tap into our bodies beyond that physical level into the more blueprint structural level of our bodies, where we not only store precious materials, but where we also can store very difficult things, where things can be put dormant. Our bodies are magical. The things that they can do for us, if you had any real understanding of how magical and protective your body is without you ever trying, when you put on weight, when you had low energy, whatever it was that you were going through, to have appreciation for how your body is taking care of you in those moments, it can change your whole perspective of gratitude for the body, even when it's hurting, especially when it's hurting. Maybe we could give it more attention if we had more gratitude, right? So I want to talk a little bit about the extraordinary vessels. I just said that, and so again, this is my specialty. I'm trying not to get ahead of myself. We have 12 meridians. Okay, those meridians are the highways of each organ. So what I mean by that is you have the actual physical organs, liver, lungs, heart, bladder, kidneys, stomach, right? You have all the organs. Each organ has an energy pathway, think of it as highway, that comes off of that main hub. And that energy pathway hooks into another organ. And there are byways and there are underways and overpasses. So we have the main highways, those are the meridians. And then we have channels and collaterals, those are sort of the side streets that come off these organs, but it connects the whole system. And that's one of the biggest differences between Western allopathic medicine and East Asian Chinese medicine that I practice, is that we see this system and how it works together and how one organ supports another or how one might overtake another, all kinds of other theories about the body. But underneath those 12 meridians, which if you know anything about East Asian Chinese medicine, you've probably seen the doll with all the lines, those are the 12 meridians. Then we have the 8 extraordinary vessels. The vessels are less worked with, they're less understood generally. I do not have the arrogance to think that I fully understand them, so I treat them with great respect. Both because of my intellectual respect, but also because in real life I have seen these vessels abused, I have seen these treatments abused and used incorrectly, and I have been taught by some very good people who have explained why that is dangerous and how that can impact people, and I've seen it, unfortunately. I have stories to tell about that. We won't be doing that today. So these vessels are reservoirs, essentially, but they are also, and they hold our sort of most precious materials in storage for us to be utilized and used when we need them, but they can also become ditches for where we can put things that we might not know how to process or be able to deal with. This is a service that our body does. I don't have the resources mentally, emotionally, or physically to deal with this, but I do have the energy to hold this for you. So when we are talking about spiritual healing, which again I define as something greater than yourself or something that is a non-physical embodiment of your being, a feeling, a thought, an experience, something that is not physical. So I'm going to read to you a little bit from this book to talk about it, because it talks about it a little bit better than I do, and then I'll give some specific examples and talk, maybe I'll talk about some patient experiences and personal experiences that I've had with these vessels. Okay. So there's a little metaphor in here, so bear with me and feel free to ask questions anytime. When rain pours down from heaven, the ditches and reservoirs, that would be the 8 extraordinary vessels, become full. The ditches are beyond the reach of the primary channels. So primary channels have their own flow of chi and matter. This is beyond that. This means that surplus resources are stored in 8 extras, but we can't access the richness in good health or the pathology in compromised health with the 12 primary channels. So I can't use the primary channels and treatments and theories of the typical kind of Chinese medicine you're going to get going in off the street. If you just see acupuncture and you go in, they're going to be treating the 12 primary channels. We're going to be moving blood, we're going to be moving chi, we're going to be giving you circulation, we're going to be, in Western terms, like helping with inflammation, helping with circulation, helping with lymphatic flow, we can reduce inflammation. I may have already said that. That's sort of Western terms. But in Eastern terms, that's what we're doing with the 12 primary channels. We're just moving all the stuff we can see and feel and touch, and we can kind of have some immediate effect, like you come in with nausea and I help your nausea go away, or help your headache go away, or help your back pain go away. It's more skin level. But when we're talking about pathology of the mental, spiritual, emotional body, when we're talking about anxiety, depression, chronic grief, things that are gripping in us emotionally, trauma, past trauma, whether that be CPTSD or PTSD, or as I like to call it, PTS. I don't think typically that post-traumatic stress is a disorder. I think it can become disordered, but I think that is mostly due to the lack of treatment and social body surrounding us. Okay, mechanisms of the extraordinary 8 channels. So the 8 extras are conduits of our constitutional chi, our Yuan chi. Yuan chi is what we get from our ancestors, okay? It's a collection. It contains our ancestral inheritance, our nature. The 8 extras therefore govern, this would be like DNA in Western medicine. The 8 extras therefore govern the creation of form. Okay, so this is where we talked about blueprints. So I'm going to take this into real terms. When I became pregnant, right, and the sperm and the egg came together, so they were a sperm and an egg, and then they come together to form a new thing. In biology, we talk about the splitting of the cells. In Chinese medicine, we would talk first about the energetic body that is formed, the energetic blueprint on which those cells and that material then form from. Okay, so it's the idea, the energy of what is that thing? How does it know what it's becoming? That's the 8 extras. The first 8 extra, I was just about to say this, the Chong Mai, is the blueprint. It's like a set of construction drawings. And then it starts to go into the Ren and the Du. The Ren channel is a warehouse that stores or provides materials, yin, for building. The Du is the construction crew that provides the energy, the yang, to build the being according to the blueprint stored in the Chong. The building performs its function in space, aging and changing through time. The Wei channels govern the assimilation. Okay, this is going way over your head. The Chao channels reflect the present, right? In other words, the 8 extras encompass a whole world in and of themselves inside your body. You have the topical layer, right? The Wei Qi, which is sort of your pores and the hairs on the outside and the opening and closing, that kind of energy, when you can feel someone's energy coming towards you. And then we go into the skin layer, and then we go into the muscle layer and the sinew layer and the bone layer and the blood layer. But underneath all of those layers of form and function, we have that energetic blueprint map of how we were constructed, how we move through space and time, and literally the poetry of how our bodies metabolize our lived experience beyond the air that we breathe, the food that we metabolize, right, into the thoughts that we think and the feelings that we inhabit and that we live in every day. That is what the 8 extras are about. And this is very deep. I mean, there's no way I can cover all of it, period. But when I have someone come to me, and this is the most kind of common patient that I had, and it's a part of why this specialty grew for me, not only because I had a personal interest in this layer of healing that was beyond psychology, that was beyond anything of the conscious mind, right? The kind of things that you would get into, say, with meditation, or even different plant medicines that even the government has worked with. I'm not going to say them because I will get bananaed from my live. But beyond the physical body, there is a body and energy of emotion and, again, with air quotes, spiritual beingness. And those things can cause us a lot of disease, mentally and emotionally, which can also somatize into our bodies. So when we speak of spiritual healing, for me, we speak of the 8 extraordinary vessels. And when someone comes to me and they say, you know, my dad was a police officer. I'm going to give some real examples. I had a 15-year-old boy that I used to treat. This was before I was in private practice. I was still an intern. I remember him very well. I don't know why he's coming to mind at the moment, but here you go. 15 years old. He had severe Crohn's and colitis. It was devastating to see. I was the second person that he'd been treated by, because you had to switch practitioners every 3 months because that was the cycle of our school schedule. And he had a father who was a police officer. I can't remember now if he still lived with him or not. I feel like he did not. But his dad was very violent and very angry, yelled a lot, kicked him, hit him, had been doing it for years. He was now 15 years old, beautiful boy, just a beautiful, lovely boy. And he had internalized this abuse into his small intestine, into his digestive tract. He knew it. That wasn't something I was putting upon him. Diagnostically, I would probably see it that way. When you don't have any place to put energy like that coming into your body, there's only one place to put it, which is in your body. He had no way to work that out for himself. He was in an active process of it. Acupuncture was a part of it. And he came to see me and my supervisor because he'd heard about this aspect of Chinese medicine, this spiritual healing. And so what we're able to do for him, even though this is an issue of an exterior or middle ground part of the body, the digestive system, right? It's very tactile. This affects his food. This affects all of his digestion, his mental health. When your gut is that messed up, your mental health is messed up, right? We can't separate what's right from wrong, what's clear from turbid. Our boundaries are broken. We have leaky gut. It's inflamed. It's hot inside. It's emotion that's being somatized and held. I might in some cases treat the actual symptoms that day depending on what's going on and what the test results show me and what the person's complaint is, but he was there for a deeper healing. So in that case, I'm looking at these vessels. I'm looking at these ancestral, right? This DNA, this blueprint. And where does he come from? He comes from his father. This was his biological father. So there's ancestral holding an energy there that comes with him, which is also encompasses his father physically and embodies him. But then there's also this experiential reality that is uniquely his, of his body and his interactions with his fathers and that abuse that's coming at him. And how the body takes that in and somatizes it will always typically involve something that big, will always involve these deeper ditches and reservoirs in the body that we call the 8 extraordinary vessels, where we hold precious material that can help us to heal, but where we also have this deep knowledge of what we are and what we come from. And when you can tap into that, when you know how to tap into that and someone is ready, willing to tap into that, you can do amazing things that are not in any way cerebral. So I can't sit here and talk to you about this blood test and that blood test, or I can only talk to you in metaphor. So in his case, what I did is I treated what was discussed in that book right there. I treated the Chong Mai. The Chong Mai is essentially your flagpole. It's your center. You can associate it loosely with the aorta. If you know the aorta, it goes straight through the center of your body. It comes from the heart. It's the main highway, the main vessel of your physical being. But under the Chong Mai is the energy, or under the aorta is the energy of the Chong Mai. And it's that blueprint. It's who am I, the center of me, the core of me, the truth of me. And so there are 5 different trajectories of the Chong Mai. So we have that main vessel, but then from that main vessel, it can impact our bodies in 5 different ways that are very specific. I can actually show pictures to patients and say, which one of these do you relate to the most? Just generally, when you look at these, what do you feel the most connected with? And it's really interesting. People always pick really the one I would pick for them because it's very obvious. The Chong Mai has parts of the body that relate to the chest and the heart and the eyes and the mouth and the senses, the sensory orifices, also the genitals, also the abdomen and the chest, right in the center of the body. And then there's a trajectory that starts off, well, they all start off on the foot because the Chong Mai opens on the inside, the medial aspect of the foot, behind the first metatarsal. That's how we open it. These are like magical little doors that we can use. So in this young boy's particular case, I do believe we use the Chong Mai quite a bit to tap into that ancestral part of him that is unconscious, that he was born with, to tap into that insight, that information. And then also to tap into, in his case, the trajectory I used was the one that correlated the most strongly with digestion. digestion and the heart. Because that was where, for him, his body was capable of holding, but it was causing a lot of disruption, right? In a way that was debilitating. I mean, he's 15 years old dealing with severe Crohn's and colitis. And for him, during that point of treatment, I think I got to treat him for about 3 or 4 months. He might have stuck with me a little bit longer. What we got to see was an improvement in his blood tests, but more importantly, a reduction in his pain, and acceptance of pieces and parts of his life that allowed him to make space to continue on his healing journey, right? To not be at the same level of pain and disruption, to bring some calm, to bring some clarity without having to use his brain, without having to tell the stories. He would just come down into himself and feel more at peace and at home with himself, and then see those symptoms in his belly and in his body calm and soothe. And what I've noticed over about 15 years of this, of observing this type of treatment in people, you know, people want to know, can you cure me? Cure is such a funny word. It's such a funny word. Anyone who's really serious about treatment and healthcare and patients can be very honest about that. I'm not the only one. There are other people who get it. Anyone selling you a cure, I would be wary of. Can you be without symptoms for the rest of your life? Might you never deal with this again? Sure. And who am I to say what a cure is? That's a personal thing. But in general, what I like to look for is the reduction in symptoms, the ability to live an easier life, and perhaps, if we're really lucky, a shift in perspective that helps us to continue on the path of healing to maybe what we consider a cure. I mean, I've had people who say like, oh, you cured me, you know, you changed my life. It's humbling, but it's not me. You know, it's this ability of our bodies and this way to tap in to these deeper messages and pathways and miracles, really. So I'm a little bit at a loss of where to go from here, but what I will say is, you know, acupuncture isn't the only way to get into these vessels. These vessels are a part of you, whether you agree, whether you like the language, whether you think it's hooey, it really doesn't matter. It is there. I know enough to know that. And so whether it's meditation, whether it's walking, whether it's doing art, whether it is singing, sleeping, journaling, whatever it is that helps you to tap into this deeper part of yourself, to give you peace and soothing, and to connect with who you are, your energy, your truth, without the conscious mind having to be there. That is what these vessels are. And what I love about the acupuncture access points is that it's passive. You don't have to know. You don't have to get your head around it. You don't have to understand it. All you have to have is openness and willingness to heal. And to say, I don't know, but I'm here to heal. Once you get to that place of openness, and you lay on a table and you experience something like the magical things I've learned, it's indescribable. I've seen it time after time after time. People are always curious, what's going to happen? Can you tell me? And I just kind of give them general things that I've seen, that I know, that I've experienced. I say, well, you might have different sensations in your body you've never felt before. You might feel swirling, like you're swirling down a drain. You might see colors. I used to, when I laid on the table and get treatments like this, feel like my body was literally splitting in the middle and coming in half. It was like, I'm going to show it on the live. It was like I was even, and then they would put the needles in, and I could feel in the center my body coming apart, like from the center, and then going lopsided, and then coming out. And I would lay there like that. And then at the very end, I would usually feel it come back together and straighten again. Not always completely, but pretty much. So it's like these physical things that happen that I could sit there and analyze it and write a paper about it. No thanks. I'd rather just lay there and experience it. And then you get up off the table and it's like you're looking through different eyes. You're inhabiting your body in a different way. And things that are that simple, that allow you to feel and experience your life differently from 30 minutes, 40 minutes before you got on that table, that can be very profound. Like I said, there's the actual physical healing aspect. But that mental, emotional aspect of, wow, things can be different and change without drugs, without having to put in effort. I can just observe this process in my body. I can observe this experience. I can inhabit this experience and go, holy crap, how is everything so different? Like, what does this mean? I mean, it can be very, very profound. You have a lot of patients who will end up wanting to study it, or get involved in some other way, or just come back for more treatments. Like I said at the beginning of this, right? People come in for something really severe, like their childhood trauma, or a car accident they were in, or a chronic issue that they have that nobody else can fix, and we work on that. But then they discover, oh my gosh, this is actually like a resource I can use for kind of everything to build my health overall. Colds, flus, pains, aches, prevention. Prevention is the big one. So spiritual healing, yes, it's possible through all things. You have to first define, what is that for you? What does that mean for you? Or don't define it. Just be like, I don't freaking know, but I'm curious. And just try things. And if you want to do something passively that might blow your mind and might help you out, try acupuncture. It doesn't even have to be the 8 extraordinary vessels. It can just be the 12 channels. It can just be feeling what it's like to feel your chi flow normally and to be regulated. Even if you're in quote unquote great, good health, to go in and say, I want to try it. I got a little tension in my shoulders. I'm a little stressed. See what can happen. It's a different level of healing. It's a different non-cognitive, non-thinking, Western ego-driven mind way to experience our bodies and this life and our health and our ability to heal and to appreciate our bodies in a new way. So anyway, that was a long one today, 32 minutes. Thanks for getting poked. It's snowing right now, but there's some blue sky, so spring is coming, they tell me. Take care.